Vice President. Most important thing. I'm only signing it because it costs nothing.
He almost forgot to sign the deed, but US President Donald Trump is closer to picking apart his predecessor's healthcare reforms. Obamacare aimed to provide affordable care to all Americans, and 9 out of 10 US citizens now have health insurance. But this kind of coverage has come at a cost. The federal government is paying insurance companies to provide affordable coverage to low-income Americans. But the executive order signed by Trump ends these subsidies. And it lets people and companies circumvent Obamacare rules by opting for bare-bones coverage plans.
First, we aim to allow more small businesses to form associations to buy affordable and competitive health insurance. This would open up additional options for employers to purchase the health plans their workers want.
The Affordable Care Act was passed in 2010, but the subsidies paid by the government have never been provided legal cover. The law requires all Americans to buy insurance plans, but many complain of high premiums and a lack of health plans to choose from. And those who don't sign up for insurance must pay fines. The Commander-in-Chief says his executive order trumps Obamacare.
Insurance companies will be fighting to get every single person signed up. And you will be hopefully negotiating, and you'll get such low prices for such great care.
But critics say insurers are now free to ignore high-risk groups like the elderly, those with pre-existing conditions, and young people who can't afford high premiums. The government will save money, so its fiscal strength should improve. But it could come at the cost of the well-being of millions of Americans. Mobin Nasir, TRT World.
Let's go to Morgantown in West Virginia now, and joining me from there is Dr. Simon Haeder. He's an assistant professor of political science at West Virginia University. Dr. Haeder, welcome back to Money Talks. Now, look, Donald Trump says that by cutting subsidies to insurers, he's saving money that is going to companies, insurance companies now, that could go to helping ordinary people with medical conditions. He does have a point, doesn't he, that the system is unsustainable right now?
That's correct. We're paying an extraordinary amount of money that is just not going to the right place. It's high administrative costs, high healthcare costs, low quality, and we need to do something about it.
So tell us a little bit more, though, about what he's doing, and do you think it's going to work?
Unfortunately, I think it shows a misunderstanding of how the Affordable Care Act works and how especially these subsidies works. Indeed, if you really look at it, it's going to cost a lot more for the government because they have the requirement to pay these nonetheless. And so it's going to be about $200 billion more actually in cost for the federal government.
Okay, so Dr. Haeder, America has found it very hard to provide universal health care, even though it is the richest country on earth. Why is that when so many much poorer countries are able to do so?
Mm-hmm. I think the biggest factor here is that there's no ideological consensus whether having access to healthcare is actually a right. And when that ideological consensus is not established, the parties can battle over it and they can get partisan and electoral advantage out of it.
But it's a political issue, but other countries seem to have overcome these kinds of debates.
Yeah, I think the big problem we see here is that there's a certain sense of appreciation for a certain kind of liberty in this country. And there's a large part of the country that sees requirements like getting health insurance and paying for it as infringement on that liberty. And the country is basically split half and half on this one.
Okay, so let's talk about the Affordable Health Care Act itself. Now, the number of insurance companies providing cover has fallen sharply. Isn't Trump right to do something about that before the whole system collapses?
It's certainly right that we have a problem that few insurers are providing coverage. Unfortunately, the actions that the Trump administration have taken is doing the exact opposite. It's creating large uncertainty. As we know, companies don't like uncertainty, and they're just dropping out in large numbers. And the recent executive orders may make this actually worse than better. Okay,
so Dr. Haeder, if you were advising Donald Trump right now, what would your advice be to him?
I think the smart move would be to go to Congress, find a long-term stable solution that creates certainty in the markets. And once we have certainty, everything will start to stabilize. And I think that would be the most important part, stability for the future.
So what is next for this battle? The Democrats say that they're going to sue. Is that going to work? Meanwhile, premiums are just going to keep on going up, aren't they?
Yeah, nothing the Trump administration has really done has improved premiums. As a matter of fact, they've done a lot of things that might actually make the whole situation worse. We'll really see over the next few days whether insurers are getting too concerned about the recent actions. They might actually start dropping out in droves over the next couple of weeks. So there's a lot of stuff to come, and Trump himself has said that more is to come pretty soon.
Okay, Dr. Simon Haeder from West Virginia University, thank you very much indeed.